Hi everyone, we're back. Welcome to Module 2, Intermediate Trauma-Informed Care and Resilience Certification course. We call it TICR 2. And this is Class 2, What's My ACE Score and How to Start Healing. All right, these are the class objectives for Class 2, What's My ACE Score and How Do I Start Healing. First of all, you are not your ACE score. Secondly, ACEs happen to people, not because of who people are. So that's not a blame shame game. The ACEs Aware Initiative in California is gigantic. We're going to talk about that. We're going to talk about the ACEs screening tools and adult resiliency tools that are out there. And how do I start healing? What are some ways that we start moving in the direction of healing? Because ultimately that's what we want. And then we're going to shoot you over to the podcast Delusional Optimism to listen to an overview of ACEs, all we have learned so far, part 1. It's a 2-part series. Okay, let's kick it off with talking about the ACEs Aware Initiative in California. This is Dr. Nadine Burke-Harris. She happens to be the very first Surgeon General in California. She was appointed by Governor Gavin Newsom in California in January of 2019. Millions of dollars was allocated to battle adverse childhood experiences in California and to train medical providers and mental health providers in particular to recognize trauma as a lifelong mental and physical health consequence. So we could start to begin to have those conversations and really start serving people at the beginning of life to battle trauma rather than having to wait for people to have symptoms of that trauma much later down the road in life. So this was a massive initiative in California. It is a massive initiative in California. And it's traveling across the country as well, because trauma has become a highlight in our awareness of how people struggle with their physical health as well as their mental health. So the ACEs Aware mission in California is to change and save lives by helping providers, medical and mental health providers, understand the importance of screening for adverse childhood experiences and training providers to respond with trauma-informed care to mitigate the health impacts of toxic stress. That is a very simple sentence for an incredibly complex goal. And so this is never going to happen in a short 5-year period or even a 10-year period. This is a generational shift that's going to have to happen in order for these things to actually get put into place. But the way that happens is by everybody learning about trauma and how it affects themselves, how it affected their family, people they love, people they're in relationship with, their friends. So we normalize the experience of trauma, and then we move into a system that actually addresses trauma at the front end. The Devereaux Adult Resilience Survey. So Devereaux is a company, and they actually produce a survey that measures resiliency in adults. And you can look at this survey. I'm not asking anybody to do this survey. If you want to look at it, you can. And you can look up the Devereaux different surveys that they have. But this is a way of looking at things that may have happened to you or supports that you have in place, and then how often do you have access to those in order to kind of get a sense of your resilience, even if you have experienced trauma. Because many of us have experienced high levels of trauma and still have overcome significant adversity and been able to manage and be successful, or be whatever successful means exactly. But been able to mitigate our trauma with healing. Then there's other people, especially even people close to us. People talk to me all the time about my sibling. What's that story? How does one sibling succumb to trauma and another sibling overcome trauma when they live in the same family? That's a whole other class. However, these are really important questions that we need to be talking about. And the answer comes down to resiliency. Who was the primary relationship? How did that happen with the person who has more resilience than the other person who has more consequences from trauma? Okay, so this is the adverse childhood experience screening tool. These are some of the questions. And at the very end of the tool, it asks, how do you think this impacts your health? Not much, a lot, some. And so if you're ever offered this tool, I will say this. ACE screening should never be done without a purpose and without a relationship with the provider. So whoever's offering an ACE survey to you or your child or anybody in your family, they should first, one, explain it to you. Two, warn you that it can be triggering, because the ACEs screening, even though we talk about all 10 of the adverse childhood experiences, remember there's physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, and then the family challenges that happen, family member imprisoned, substance misuse, domestic violence, those things. So if they haven't explained why you're doing this survey and that it might be triggering and that that's normal and that's not an uncommon response and that they're there for support and have support for you, then you should just not engage in that survey at that time. That's my personal opinion. I find that we do way too many screenings with not enough support behind them. And this is what mental health providers really need to figure out for themselves, how they're going to incorporate this screening to be useful, not only for their work, but mainly for the work and healing of their clientele. Same thing goes for medical providers. You might be told, oh yeah, just do ACEs screenings and collect them, because they are a billable screen. But if we're not going to use the results, we shouldn't be putting our patients or our clients in a position that could be vicariously traumatic for them again. Okay, there's also an ACEs Aware questionnaire for children, and it's identified and it's in English and Spanish and several other languages. So again, I'm not going to repeat all of it, but again, a medical provider or a mental health provider or whoever is handing this form over to a person to complete for either a child or for themselves, they should first be warned about it potentially being triggering. Two, they should also know what they're doing and what the purpose of it is. And then how they're going to be supported once they've completed this survey, what it's going to be used for, what's that data, where's it going, how's it going to help me. There's also a teen survey, so teenagers can do this survey for themselves. Also, it's in English. This one's in English, but it also comes in Spanish and other languages. And same thing, I'll say it again. This is one of those things. Is this going to be triggering? Are you going to share this information with my parent or caregiver? You know, I might be really hesitant about revealing sexual abuse if you're going to turn around and share this information with the person who's sexually abusing me, who's sitting in the waiting room waiting for me. These are the deep questions that we have to be asking while we're doing this work, because that is at the end of the day the key to getting accurate information and then leading the path to healing. What happens when you have conflicting scores? People do actually ask me this all the time. And generally speaking, people don't often have conflicting scores that are really dramatic. You know, it's like a 3 or a 4. One time it's a 3, another time it's a 4. So that's pretty normal. Like, that's not atypical in terms of doing an ACEs screening. ACEs screenings are pretty direct. They're like, were you physically abused between the ages of 0 and 18? No, I was physically abused at 21. Okay, that's a no then. That's a no. However, what we know about the ACEs screening is that oftentimes, if we ask somebody if they have an ACE score, if we ask somebody if they have child abuse history, they say yes, we mark check yes, or, you know, a 1 on the screening. Whether that abuse happened one time in their childhood or 1,000 times in their childhood, what we do know is it doesn't really alter the consequences of mental or physical health consequences later. So we don't need to know the amount of physical abuse or the amount of an emotional abuse or the amount of sexual abuse that happened in childhood, birth to 18. We just need to know if it happened. And that's where the research directs us, because it's so profound that if your ACE score is a 3 or a 4, we can get lots of different outcomes with those numbers depending on relationships, their birth order, their genetic constitution, their support system, their access to healing providers, the age in which interventions were provided. So there's lots of things that can happen. So having a conflicting score is not a problem. It indicates sometimes that people just are in a different place at a different time, and that's perfectly fine. It would be highly, highly irregular for somebody to report an ACE score of 1 and then to come in and report an ACE score of 6, or, you know, to have a very large span. And if that did happen, then I would want that person to actually sit with a mental health provider and talk that through and try to figure out what's going on, because that would be just highly irregular. Okay, so there are lots of protective factors to humanity, which is so wonderful for us because we can be exposed to a lot of trauma and we can still be resilient. This is why I am a delusional optimist. Even though my leaving a life print all lends itself to reducing trauma, especially in childhood. So, but there are lots of protective factors in our world. And individual and environmental characteristics are thought to moderate or buffer the negative effects of stress and result in more positive behavioral and psychological outcomes in at-risk children than would have been possible in their absence. So let's break that down. Children have come with a package, like a child who has a positive temperament, a positive mood, which is a characteristic that comes at birth, are less likely to be harmed, to be abused in infancy and early childhood, just because they're a little bit easier to take care of a lot of the time. None of that is the fault of the baby. But in a certain situation and environment, okay, that helps us to say, okay, baby with a negative mood or a more negative mood or a high crying irritableness about them in their temperament from early on, we need to provide some more supports to that family, that mama, that, you know, those parents, whoever the caregivers are for that baby, because we know that that's going to be a more stressful environment. We need to provide more supports for parents initially in the first place, because parenting is such a complicated, exhausting, stressful, and triggering experience. Because everything that we've already gone through in our lives, now we have a new person in our lives to activate it once again as they go through it. And we often never talk about that level of consciousness of what we've been through to now what we're experiencing somebody else go through right before our very eyes. And that's powerful stuff. There's an entire field of study called maternal mental health and parent-infant mental health that really revolve around that depth level of thinking about our firsthand experience related to the next generation's experience in our infants. Okay, remember this. It's so important. This is not about blame. This is not about shame. You are not your ACE score. If you had a parent who struggled with alcohol or different substances and misuse or sexual abuse or physical abuse or anything like that, it is not your fault. I cannot say that more confidently and securely and soundly. Please, please step back and do not blame yourself for something that happened to you, not because of you. The failure comes with you not being in a protected place, and that can't have anything to do with littles. Our littles expect and deserve and require us to protect them. So this is the starting point for healing, is letting go and trying to find the ability to not blame ourselves and not shame ourselves for things that happen to us, around us, or with people that we do love. You are not your ACE score. I'm going to keep saying it. If you need to, put a Post-it note on your mirror and say it every single day. I am not my ACE score. I am a resilient, strong, loving, confident, supported, lovable, worthy human being. Put that on a Post-it. Put it on the bathroom mirror and read it out loud to yourself, because those things do, remember, where the brain wires, where the brain fires. So if you're saying that on a continuous basis, that's actually helping with healing in a really low level difficulty way. It's not hard. It's easy. You just read it over and over again. So we know that ACE scores correlate with health risks: heart attack, heart disease, diabetes, stroke, mental health struggles. So just because those things are happening or potentially could happen, they can be buffered and mediated if we're aware of it early. So if we find out about our trauma, like if we become aware and start healing our trauma earlier rather than when we have a stroke, the likelihood of having better health outcomes increases. Who am I? You're you, a person with a story that might include some adversity in childhood experiences, ACEs happening in your life. Like, that's just the reality. We all struggle with these questions of who am I? Am I good enough? What's my purpose? All of these things. But the reality is that we're all our own individual selves, and adversity does happen to most everybody. So what we want people to be able to do is to learn and find out as much as they can about their own story, their own history, their own narrative. Because when we're able to put our narrative together, and when we're able to teach young children their narrative as they grow, that creates a consistent story, which is helpful to healing and to being healthy, because it makes sense. What makes us feel crazy is when our experience and our story conflicts with our experience and our story. We feel this chaos, you know. I love these people, but they hurt me. That's conflicting and it creates chaos in our brain. We have to find ways to heal, to close that loop and say, two things can happen at the same time. I can love somebody who also has hurt me, and I can also set a boundary or create space where I'm safe from that person. So it's not either or all the time. It's a both and. Sometimes people just decide, you know what, that person hurt me. I'm clear I should love this person, but you know what, I don't. And I'm not going to blame or shame myself for not loving that person. Okay, done. Okay, that's part of the story, the narrative that leads to healing. Oh, again, who am I? So having trauma does not make you a bad person. Even if your body and brain learned how to cope in ways that aren't healthy or helpful to you anymore. So children growing up in chaos, children growing up in fearful environments, in abusive environments, in unpredictable environments, unsteady, unstable environments with people who are not consistent in any way or even loving, will then have to adapt how they behave in order to survive in that kind of chaotic environment. And then here you are, a grown up, and what do? You seek chaos. You seek chaos because chaos feels familiar, because that's what you experienced as a child. And so chaos feels almost more comfortable than stability, because stability says something might be wrong. Like I'm waiting for the next shoe to drop because this is not my normal. And this is, again, this is an entry point for healing when we recognize, oh, wow, I experienced all this stuff. It was pretty chaotic. I don't like that feeling. And I need to figure out ways to feel good in healthy, predictable, stable ways. And then with the help of mental health professionals and other people, like I said, this is a generation's worth of work. With the normalizing of talking about trauma and mental health, we will also be able to scaffold and support each other in recognizing how to cope and learn to have expectations in our relationships and in ourselves to not continue these cycles of trauma. All right, I'll say it over and over and over again. You should too. The brain wires when the brain fires. So let's find out how to rewire for healing. We rewire, well, our brain fires when something is activated. And when it's activated, if it's activated over and over and over again, remember, that's how the wiring in the brain happens. So what we want to do to wire for healing is to have activating experiences that are healing to override the wiring that was in place that was chaotic. This is not easy. This is not necessarily even completely possible. So I don't want to send you off thinking, oh, I can just rewire my whole entire brain and everything's going to be fine. That is not true. Everybody trips and falls at certain points and goes to their lowest level of coping. And then we recover and we come back and we're like, oh yeah, that was when I was little. That's when I didn't have a toolbox. That's when I didn't have loving relationships and people around me. That's what that was about. And it's okay to trip and fall and stumble, because we're also allowed to recover and come back to baseline and say, remember, this isn't my fault that these things happen to me. I'm doing the healing work now to rewire my brain so I have the capacity to reset and continue to move forward. And life is all about growing. We grow and change and grow and change and rewire our brain all along the way. What we do know, though, is that the initial early wiring of the neural pathways in infancy are the most powerful roadways that we set down in our brains across the lifespan. Even though our brain has a lot of plasticity to it, which means it's able to still change and develop across our lives. So now let's do an activity together. Okay, so I want you to practice just a breathing exercise. It's really basic. It's kind of boring. I know you've probably even heard it before, but I want you to feel the difference in your body when you do this. Because remember, when we practice doing something over and over again, we're resetting ourselves. So this is called, I like to call it 21 because it's 777. So you take a deep breath through your nose and hold it for 7 seconds. And then you breathe out through your mouth until all of it's gone. Then you do it again and you do that 7 times. So let's try it. We're going to go. Okay, I did it 3 times. You should do it 7 times with yourself when you have time. I can already feel in my own body that I oxygenated my lungs and my blood. My brain feels a little more open and clear because I just took that time to take it to remember to breathe. It seems so simple. You know, our body breathes automatically. We talked about that in module 1. However, there are so many times in our lives when we literally unconsciously hold our breath. And it's important to teach ourselves to, when necessary, very consciously breathe and take in oxygen to help our body heal and grow and to take care of ourselves, because it is a clearing. It's a clearing of the mind. Remember, ACEs are common. Knowing your story is the first step to changing your story. So writing stories down about your life are very important to healing. Finding historians in your life, family, friends who are your parents' friends, grandparents, anybody who can be a historian to your childhood. I happen to have an older sister, and so she's one historian to my life. Now she views her life in a totally different way than I view it. So it's not like she can tell me the story of my life, but she can provide information about my life, like when I was a baby and when she was at college and I was in 2nd grade. Like, she can tell me stories about me when I was little that help me to fill in the narrative of my life story. So you have to find people who can do that. I also have an older brother who's only 18 months older than me. So he's not a great historian for when I was an infant, because he too was an infant. So, but we have lots of experiences together. And so sometimes if we talk about those, you know, like when we were playing when we were 9 and building forts and the things that we did, that also helps to build in the story, or people's reactions to different kinds of events. So recognizing and being able to write down or record, however you feel comfortable doing it, your narrative to your story. Because knowing your story is a powerful, powerful tool in healing, and being able to recognize, again, not to shame and blame yourself for things that happen in our lives. Now, this is a little bit trickier. Actually, it's a lot trickier, but getting access to the unconscious mind. So many things happen in our unconscious experience, in our unconscious mind. They happen automatically or they're buried really deep, deep, deep within our memory system. So if you can find someone, I'm not saying this is easy because it's actually very difficult, even though people say it all the time. I even sometimes feel a little bit, you know, like I don't want to say it because it seems so simple and it's not, but guided mindfulness, hypnotherapy with a trained professional. And I'm going to tell you this right off the bat. I was not a big believer in hypnosis. I thought, I'm a clinical psychologist. I'm not a big believer or, you know, I'm not super into hypnosis. And then I actually had a trained hypnotherapist work with me around trauma. And man, I have to say, I was blown away at the amount of emotional work that I was able to do with guided mindfulness and guided imagery as well as hypnotherapy. Now, I actually think this person is like a one in a million. So you have to find somebody that you can work with and who is a good match for you. And if that doesn't happen, you know, it's not necessarily going to work. So this is what's so important. The most important thing in a therapeutic relationship is the relationship. Is it a match? And do you feel safe and nurtured and secure in that relationship in order to explore very vulnerable, intense trauma? And if that's not the case, as soon as you feel judgment, as soon as you feel like this person is not on your side, it all dissolves. So give yourself permission to say, you know what, we're not a match. I need to find somebody who's a match. And that's another reason that this is so important to be part of the general conversations that we all have in our lives talking about trauma. Now, the last one is EMDR, and you may or may not have heard of that with a trained professional. Be sure that if you're doing EMDR, it's trauma work. You can look up Bessel van der Kolk's work. We'll put some in the resources area. But EMDR is a type of therapy and people are trained. But there are people who are highly, highly trained in EMDR for trauma. And then there are people who do like a weekend 8-hour training. I would definitely, if you're going to look into this in order to access the unconscious mind and to really do deep work on trauma, if you want to become an EMDR specialist, be sure that you become the kind of specialist who actually specializes in something. Devote your life's work to that type of work and become a true expert at it. Because it really doesn't help anybody in the world when we just cut the surface and we try to be all things to everyone. That doesn't work so well, and we end up having a lot of people who claim to be able to heal trauma, and they really don't understand trauma in the first place. And I hate saying that, but I want to give people who have trauma the reality check they need to say, you know what, that didn't really feel great to me. You're right, it probably didn't feel great to you, and that's not your fault. That needs to be part of the process. Now, having said that, I also want to say that you need a therapist or a mental health provider who can challenge you in the work that you're doing. So when you are reporting something that does not necessarily serve you well, that you're able to hear it in a loving and compassionate way, that maybe that's not working out so well for you. So it's a tricky dance, but this is why we're having these kinds of conversations. And when we start to dig deep into the unconscious mind, then we're in a whole different landscape. But it's an important landscape that we're uncovering more and more about. Super exciting stuff. Resiliency is real. It's a thing. Overcoming adversity is real. And relationships make it happen. Emmy Werner, my Shiro, she did the initial groundbreaking research on resilience on my favorite island, Kauai. And this is a variation of something that she said all the time, which is the most powerful protective factors in the life histories of resilient children was the presence of one caring adult in the child's life, most powerfully a parent, but often a mentor or surrogate parent. So she wrote a book called Vulnerable but Invincible. And that book is that's about the research that she did in Hawaii around resiliency. And really, at the end of the day, it comes down to one caring adult in a child's life. We can do that. We can do that. Okay, let's start to wrap it up. The truth is that adverse childhood experiences impact the entire trajectory of a person's life. And that's okay. It makes us who we are. Our life experiences make us who we are. That doesn't mean we want to put trauma on people, but it does make it okay that if we have trauma, that we're still okay, worthy people. We also have the ability and the power to build resilient children, families, and communities by preventing adverse childhood experiences in the first place. We want to have a tolerable amount of stress in children's lives, or positive amounts of stress in children's lives, not a surge of toxic stress that interferes with their healthy emotional and physical development across the lifespan. Some final thoughts. Adverse childhood experiences are preventable when we focus on, again, I'm going to say this over and over again, safe, consistent, predictable, and nurturing relationships. Those things equal stability, and we all need stability. When we feel stable, we can conquer anything. And when we feel chaotic, guess what? It's very difficult to conquer anything. So, and we build in access points for children, adolescents, and adults to get the help needed to heal from abuse and trauma. When we talk about trauma in childhood, in adolescence, in early adulthood, we create access points in order to get support and help before we wait until somebody's in their 70s and has a stroke and diabetes, and we're like, oh, wow, you had severe trauma in your early childhood.